So my name is Alex Baldacchino. As you can imagine, my origins come from very humble backgrounds in Malta. And I've always been interested in people. Hence, perhaps that's why I went into medicine, graduated in Malta as a doctor. But I wasn't sure if I was really interested in the pharmacology and the pharmacokinetics of medicine when it comes to people. So that led me to do, I was fortunate enough to have a Commonwealth scholarship in London, where I discovered a field that I wasn't really appreciative of, and that is psychiatry. And then from there, I've decided to do my psychiatric training, which takes around 7-8 years to do in the UK. But during that time as well, I wasn't really sure I wanted to do psychiatry. And within that, I discovered the emerging field of addiction medicine, addiction psychiatry. So during the time of my training, I realized that I have a lot to learn, not just from my patients and people communities, but also a lot to learn around this emerging field called addiction. And as a result, I managed to do some postgraduate degrees in Cambridge and Edinburgh and Dundee, and which culminated in me managing very, well, I suppose successful, because I got the post to become a full chair in addiction, as a professor in medicine, psychiatry, addiction, which is the first clinical professorship in the University of St. Andrews 10 years ago. But my passion and my interest was still around addiction, even though my title was that of medicine. And so I pursued, the ability to explore further what one could do different in the field, but equally be part of the system where there is a recognition that one needs to do good research, needs to understand the science, needs to get the grants, needs to do the publications. But there was another element to.
Okay. Right, so I'm going to move a little bit further forward because we got a lot of what you already said, I think. So what has been part of this program enabling government, health services and innovators to do that they couldn't have done otherwise? What do you think that's allowed them to achieve in part of the program?
I think, I'm a firm believer, if the stars are aligned, then you could do so much more than if you try to convince governments. So at that particular moment in time, the governments and the policymakers, I think the fact that COVID has happened, realized that, is what we've been discussing lately, is this notion that if you get people together, you can actually make a difference and you can actually save lives. So, I was asked to chair this what we at that time was called the consortium, innovation consortium. And the first thing we did is we got the major players, either government policymakers, but also practitioners involved, including service users involved. And that was, at that time, was a sort of an interesting idea. Now I think it's more mainstream and considered and expected that that type of government group should have such a varied and number of different experiences. And the other thing is, I think partly my and my team's knowledge base in the field of addiction medicine, where addiction strength and also weakness is the fact that there are people, experts, scientists, service users, players, health and social care, and other stakeholders, where there is a tendency to polarize a situation. If you're not in the harm reduction field, you must be in the abstinence field. If and it goes on and on and on. So what we did when we set up this group, which kept on working together until the challenge call was official, and then the steering group was the group that took over, was made up of people who actually were very polarized in their mentality, but working together, you could see the growth. You could see the fact that working together means not necessarily working in one camp or another, and that's something that I call relationship capital. You work hard on that, getting the relationship at a level where people know what their responsibility is in order to do something different. And as a result, once the call came out, and there was a lot of interest. I mean, not necessarily a lot of interest in media. There's always a lot of interest in the media, but a lot of interest of groups, because the specification of the application was that you need to show that you have health and social care stakeholders involved with industry, service users involved with industry, and also other relevance, rather than a project run by one organization and essentially what our colleagues in the US said, concerned about the solution rather than the problem, and understanding the problem to create a solution, but more, oh, I have a really great idea, it's wonderful, and it must work because I love it and I like it. So there was that conversation and narrative going on, which I think helped in moving things forward. Yeah, that's the difficult but also exciting bit of this, is that we have reached a situation, a stage where the challenge call allowed 12 prototype projects to happen. Amongst those, 7 pursued and were successful to have 12 months around demonstration and demonstrating the tech, the feasibility, the validity. And the work is not finished. There are different projects. The different projects are in different stages of development. But ultimately, the whole investment in people, resources, energy is about making a difference. And if you don't create these products and make them accessible, then you ask yourself, what's the whole purpose of this? So the fact that we are having those conversations, we are discussing these with other partners which we never thought we would, such as business schools and universities, entrepreneurs, hedge funders, and others. That we're starting being mindful and insightful about this allows us to move forward. I hope, this is a hope, that at the end, in another 2-3 years, we're having these products that service users, their families and communities are able to use to save lives.